Reducing Readmissions with Discharge Scripting with AI by Rachell Cairns for Nurse. 4827C Leadership and Management. 30382 Dr. Trina Thursby. June 28th, 2026. Discharge Scripting with AI by Rachell Cairns. Imagine you are a nurse trying to discharge a patient and you have a big stack of papers that you're trying to quickly read through so the patient can go home. You are having a flight of ideas and you are going over a packet of information about their care, and everything you learned in school just leaves your mind. The packets are hard to track and it's hard to remember everything. Introduction. Technologies continue to advance, policies are going to evolve, and new tools are always going to be developed to improve the efficiency of hospital care. One thing that needs to improve is the readmission, prevention, and discharge education. Why does discharge education need to change? Because people are being readmitted to the hospital for preventable complications. And this is Dohally ETL 2024. States that a hospital readmission occurs when a patient is discharged from the hospital is readmitted with a specific time frame after discharge. The most common time frame is 30 days. People are readmitted for multiple reasons such as discharging too soon, lack of follow-up care, lack of education regarding their care, non-compliance, and worsening illness. According to Intuition Labs, Florida's readmission rate is around 15%, which is one of the highest in the country. This is 2026. The problem with this is that Medicare insurance may not reimburse the hospital if the readmission is too close to the 30-day window. Hospitals may then be penalized up to 3% in Medicare reimbursements with the Hospital Reduction Program, the Hospital Readmission Reduction Program, the HRRP. To prevent readmissions, we can make a more efficient discharge process by giving adequate education to patients about their care. We can reduce readmissions with discharge scripting using AI to create a more preventable, time-saving, patient-centered, and effective discharge education process. Change theory. A tool that we can use to implement discharge scripting with AI is a model created by John Cotter called the Cotter Change Model. It is a model that has 3 phases and 8 steps in total. Cotter's change model is widely adopted due to the success of the model. Adolfo Carino says in an article titled An Analytical Review of John Cotter's Change Leadership Framework, a Modern Approach to Sustainable Organization Transformation. Cotter provided organizations with the blueprint for successful transformation. His work has fundamentally shaped how leaders approach and implement change, ensuring the model's relevance even decades after its initial publication. 2024. John Cotter's change model is the best to implement discharge scripting because of the detailed layers of the model with each step. Every step of the change model builds on top of each other to successfully implement an easy, straightforward process. Cotter believes that most change efforts fail because some organizations overmanage the change. And change requires inspiring people, which relies heavily on leadership. Again by Carino, 2024. The change model goes into detail about how to get stakeholders and management involved, rallying a team, establishing urgency, and how to sustain change long term. The goal of using Cotter's change model with discharge scripting using AI is not to overmanage, but to help create a more time-effective tool that is patient-centered and tailored to educational needs. Planned processes. Currently, nurses have a hard time with adequate patient education at discharge. There is just too much to do and too much going on in the hospital unit to effectively go over education before they go home. You can teach a patient how to take care of themselves the entire admission, but barriers to education such as how they feel, if they are medicated, and if they are willing to accept the education at the time to determine how much they learn. Using Cotter's change model with 3 phases and 8 steps, this is how we can help reinforce education at discharge. Phase 1, creating a climate of change, today to 4 weeks. Phase 1 includes step 1, 2, and 3. It will last from the start of the project until about 4 weeks, and this portion of the implementation includes creating awareness of the issue, talking about it, getting stakeholders involved, speaking to upper management, and creating a vision of change. Step 1, establishing a sense of urgency. Recognition that patients are readmitting due to preventable complications is step 1 of the process. Identifying that education is a factor to readmission is part of the overall goal. Patient discharge information is just generalized. It is not personal or individualized. Going over information with the patient is a hurried process because the nurses are trying to get things done and forget to cover everything that the patient needs to know. Identifying that we need to change the discharge education process or create a more effective tool to help the process is key. Step 2, forming a powerful guiding coalition. Bringing to the attention of upper management that readmissions are a reoccurring problem. Inform management about how some of the common factors regarding as to why these readmissions are occurring. Part of the reason is that preventable measures such as patient education during and after discharge are being neglected, such as education. Then, after bringing attention to upper management, we need to rally the management to change the current process. We need leaders and management who can set up and educate and implement new practices and procedures for the discharge process. Step 3, creating a vision. The vision is to set up a more effective, efficient, educational, time-saving, and patient-centered tool by using personalized discharge scripting with AI. Propose using discharge scripting with AI along with the admission questionnaire provided to show how easy it is to use. We have information and technology at our fingertips. We should be able to utilize the technology to help create key talking points in a script-like format with information about personalized interventions, medication schedules, complaints, and more. The admission questionnaire asks questions that nurses probably already ask patients, such as what foods they like to eat, what they like to do for fun, the work, wake times, and bedtimes. By using copy and paste, the nurse can fill out the prompts into the AI engine, such as ChatGPT, to help create a script with talking points to read with the patient. Here's some of the common questions on the lifestyle admission form. What time do you wake in the morning and go to bed? What is your current employment status and what do you do for work? Do you have any pets? Do you exercise? And if you do, how often do you exercise in a week? When do you prefer to exercise? What do you like to eat? How often do you eat? What times do you eat? What's your favorite meal? What do you buy from the grocery store when getting food? What is your favorite downtime activity? Do you understand when to take your medication? Is it difficult for you to find time throughout the day to take your medicine? What questions do you have about your illness? What is concerning to you about your experience in the illness process? And then you'll copy and paste prompts into AI with filled out information. Here we have the specific prompts. Here in ChatGPT, we'll have a mock patient. Create a discharge script between a patient with heart failure and a nurse who's going over discharge information. The script needs to include discharge information about how to reduce leg swelling, how to improve shortness of breath, how to obtain daily weights, how to eat a low-sodium diet, how to grocery shop for a low-sodium diet. Include 2 recipes for mac and cheese and fried chicken, specific for a low-sodium diet. Include medication information on when to take furosemide, 40 milligrams once daily, metoprolol, 25 mgs, twice a day, Eliquis, 5 milligrams once daily, the side effects, what to monitor for. Also, create a schedule of a patient who wakes at 6 a.m. and goes to bed at 9 p.m., goes to work at 8 a.m., when to take the listed medications, who likes to walk their dog after work. Include low weight-bearing exercise information that is specific for low intensity. Then here is response 1 and response 2. And it shows how to reduce leg swelling, when to take the Lasix, elevate your legs, avoid sitting or standing in one position, how to improve the shortness of breath, how to obtain daily weights, weigh yourself every morning after you urinate, use the same scale, wear similar clothing or no clothing, record the weight in a log, when to call the provider. Perfect. Now let's review the low sodium diet. What foods? What to avoid? What to buy? What to leave alone? Recipe for a low sodium mac and cheese. Oven fried low sodium chicken. Medication instructions. When to take. Daily schedule. Use bathroom, weigh yourself. Take your medicine. Phase 2. Engaging and enabling the organization. 4 weeks to 8 weeks. Phase 2 includes steps 4, 5, and 6. The main center of this phase is getting people to buy into the change. You must find people who can help implement your new tool, educate staff in the process, explain the benefits, and then generate short-term wins. Step 4, enlistment. We need nurses, doctors, management, and stakeholders to see that we can give patients information and educate more effectively than handing a packet of information, expecting them to figure it out. Staff cooperation can be difficult, but we need everyone at all levels to speak freely and effectively. We must educate leaders and management first on how to use this tool in practice. And then once the leaders are shown how easy it is to use the admission questionnaire and how to put the prompts into the AI engine, then we can start to gain the buy-in of the floor staff. Step 5. Enabling action by removing barriers. Step 5 includes meeting any uneasiness and resentment about the discharge scripting with AI to be smoothed over. Staff will be educated in the new upcoming processes. There will be an in-person lecture and in-services for education. We would introduce the admission questionnaire to everyone and show the staff how to enter the prompts into the AI. The benefits of time-saving, patient-centered, educational, and easy to use will be the selling points because all the information needed in the discharge education process will be outlined in a script format to read between the patient and nurse. There will need to be constructive criticism from floor staff so management will be able to report to AI data analysis, the accuracy of information, and how to make the tools easier to use. Step 6. Generate short-term wins. Employee satisfaction surveys will help decide if the discharge staff like the tool. Feedback on the usability, ease, and accuracy of the discharge scripting using AI and admission questionnaires will help determine what needs to be changed. Staff meetings will be held to help determine if discharge scripting is working and making it easier for nurses. To determine patient satisfaction surveys with the new process will help understand if patients feel satisfied with their form of discharge education and feel more knowledgeable about their care. With the first patient's positive review of the discharge process, a food party will be provided to celebrate. Phase 3. Implementing and sustaining change. 8 weeks to the future. Step 7. Sustain acceleration. Once some satisfaction has been found with the discharge scripting process, it is important that we find what works and what does not work. It is important to take into consideration feedback from the staff and patients regarding the new tool so it can only be finely tuned to become an effective tool used long term. Looking at the accuracy of the AI information, how long the scripts are, the ease of reading comprehension is all important to know. Step 8. Institute change. With careful watching by management, they will be able to determine if discharge scripting using AI is an effective process to implement long term. They will be able to see within 30 days if readmissions are related to lack of education, compliance, or worsening illness. Once patient satisfaction surveys result, they will be able to evaluate if discharge scripting using AI is something that they can help their knowledge so they can take care of themselves at home. Budget. The costs of discharge scripting with AI varies. The complication is to create a system that completely protects patients' protected health information. It will be expensive, but also cost-effective due to reduction of readmission rates, which will be noticed by Medicare readmission penalties. Reducing readmissions can also help the credibility, reputation, and reviews of the hospital, which will help people choose to go there. The budget goes into using ChatGPT services versus having custom AI established. Staff training, instructor fees, which would be reduced by having staff educators trained, which could be reduced. Training and boot camp for employee education coordinator. Hiring AI data analysis. New hire training, auditing, and food party for celebration. To assist in the securement of funding, we'll create a proposal using gathered information to receive a federal grant. The types of grants that we would be able to apply for would be the Agency for Healthcare Research and Quality Digital Healthcare Research Grant. We can also pitch the project to the upper management, such as the Chief Medical Information Officer and Chief Financial Officer, by showing how to reduce discharge time and reduce readmissions by using discharge scripting. We will fundraise with stakeholders at a charity dinner and auction. So, the resources for the budget. ChatGPT services standard to Business Pro account could be $0 to $225 monthly, and for a year that's $2,700. To create a custom AI discharge scripting process, it would take 4 to 12 months and would probably be more than $300,000. And then tuning, which would be optional, would be $40,000. Current staff training, $2,000 per employee, 100 to 300 employees. Posters, $2 each, 60 to 100 computers. Instructor fees, $800 per day for 7 days, 2 classes a day. Training boot camp for staff educator, $7,000 for boot camp 1 to 3 days training, food, boarding, travel, and compensation. For the current staff training, it could be anywhere from $200,000 to $600,000. $120 to $200 for posters. Instructor fees, $11,000 and $200. Training for boot camp, $7,000. We'd have to hire AI data analysis, 1 to 2 of them, and then roughly their salary would probably be around like $61,000 a year. And so for 2 of those, it would cost $122,000. And then new hire training and processing, probably around $10,000. Auditing, $600,000 to ensure PHI safety. Food for the units, $500 for each unit, 6 units for both shifts, $6,000. The overall cost would be $898,000 to $1,616,400. Discussion. Using discharge scripting with AI will be a benefit to the organization by helping reduce readmissions, improve patient satisfaction, increase quality of care, and improve reputation. The change will benefit nurses and staff because it will improve patient-centered care, it's educational, improve time management, and it's easy to use. Patients will benefit from discharge scripting because it's educational, centered around them, and increases learning retention about how to manage their illness and autonomy. By using Cotter's change model, we can reduce readmissions by giving patients quality, time-effective, educational, and patient-centered care and discharge education. References: Karen Adolfo, 2024, An Analytical Review of John Cotter's Change Leadership Framework, A Modern Approach to Sustainable Organization Transformation. Dang, Ashwat, and Dalali, Jasneer, June 7th, 2024, reducing hospital readmissions. National Library of Medicine. Janine Ungrovsky, hospital readmission. EBSCO were achieved on June 25th, 2026. Intuition Labs, May 14th, 2026. Hospital readmission rates by state, U.S. data and analysis.